While both men and women suffer from various forms of oral health issues, there are a few areas where women tend to be at a higher risk. So today we continue our 6-part series, Beyond Dentistry, the importance of the mouth-body connection, with doctors of dental surgery Lulu Tang and Bianca Valleo, focusing on women's health. Welcome to both of you.
Thank you.
So I was reading here, women have increased sensitivity to oral health and gum disease. Women, because of the hormonal changes they experience, and it can have an impact on the overall health. So, ladies, I'm going through menopause. I'm assuming that's one of those.
You're absolutely correct. I know.
All right, so explain. I think pregnancy falls in there too, right?
Everything. At every stage, unfortunately, the changes in the hormones affect women's health and affects their oral health. If you're pregnant, the changes in the hormones make you more susceptible to periodontal disease, which actually can affect your unborn baby and makes you more increased risk for having a low birth weight preterm birth. If you're in menopause, the decrease in estrogen puts you more at risk for bone loss in your jawbone, leading to periodontal disease and osteoporosis. And at any age, women who have periodontal disease, that gum disease, you're at risk of cardiovascular disease. So simply put, women at any age, every stage, it's so crucial to take care of your oral health, go to the dentist, and take care of yourself.
I want to talk more about pregnancy. There are some pretty alarming statistics that come with this.
Statistically speaking, yes. So pregnancy offers some unique health issues. For example, 40% of pregnant women have some form of gum disease. This may contribute to preeclampsia and miscarriage. 1 in 10 gum disease is linked to preterm birth. That means 1 in 10 babies. And nearly 75% of pregnant women have gingivitis. This is a condition that can lead to periodontal disease, gum infection, tooth loss, which is why me and Dr. Valleo are huge in making sure women know, even if you're pregnant, you still need to see a dentist. We know that often gets missed.
And before, in a couple of other segments that we've had with you, we've talked about periodontal disease. I think it's important to talk about how Smile Generation provides dentists that can really help target this, and more for that matter.
Yeah. What we do at these Smile Generation practices is so special. We offer saliva screening and detailed saliva testing that lets us know what are our risk factors so we can provide proactive and preventative care. So for example, for my women patients, I always like to recommend a detailed saliva screening. It measures what types of bacteria live in the mouth. Specifically, there's one bacteria that live in the mouth called FN. And if you have that bacteria, it actually indicates an increased risk for preterm birth. And going back to what Dr. Tang said, it is safe for women to go to the dentist while they're pregnant. In fact, coming to the dentist during your second trimester and being treated for gum disease actually decreases your risk for adverse pregnancy outcomes by 80%.
And Dr. Tang, I can only imagine the joy you feel when maybe a cardiologist calls you and says, I need you to test this patient.
Absolutely.
It's not just pregnant women.
Yes, I think one of the things that me and Dr. Valleo are most proud of is being a Smile Generation trusted dentist. And we are taking dental care to the next level by partnering with patients in what we call the mouth-body connection, helping them understand what this oral systemic link is and providing this network of care. Select states like ours have connected care offices. That's medical and dental under one roof. So working side by side with my medical peers has been amazing. In my office, I love bringing my nurse practitioner down to meet my patients and establishing care. One of the things we do is when we identify a patient with periodontal disease, aka gum disease, aka periodontitis, the next question we ask is, who is your medical provider? If we truly want to increase patients' health care and oral health, then we need to understand that they also need medical care. We call this a comprehensive care model because we really want to make sure we help patients live a longer, healthier life.
That's amazing. So to bring patients in, to create that awareness, how do we get them to your offices?
Yes, please go online, visit smilegeneration.com, enter your zip code, and they'll find you the closest SmileGen office so you can have access to all these amazing services.
What a difference it's going to make. Thank you so much, ladies. Appreciate it. If you'd like more information, you just heard it, smilegeneration.com, or just go to our website, thebalancingact.com.